So welcome back to another video, guys. What we're gonna study over here is about uvea, image based question regarding to uvea. We start with the condition of anterior uveitis. Okay, the first image which is shown over here, it is of festooned pupil. Festooned pupil is seen during posterior synechia. Synechia simply means adhesions. Okay, so posterior synechia, it means adhesion of uvea posteriorly pupillary muscles, right? So festooned pupil, it is seen in condition associated with anterior uveitis. Obviously, example of it, a condition is ankylosing spondylitis. Okay, so images of festooned pupil. Now the second image, spot diagnosis, keratic precipitates. Okay, KPs, keratic precipitates. What are these? This is accumulation of neutrophils and lymphocyte on cornea. What is it? Accumulation of neutrophil and lymphocyte on cornea. Okay, just you have to differentiate between diffuse keratic precipitates and mutton fat keratic precipitates. Okay, so diffuse keratic precipitates, they are present on whole of the cornea. Okay, whole cornea. Example of it, it is herpes simplex virus infections. Okay, so diffuse keratic precipitates. Mutton fat keratic precipitates, they are present in granulomatous uveitis. Okay, so granulomatous uveitis causes examples, these are tuberculosis, sarcoidosis, leprosy and syphilis. So mutton fat keratic precipitates present in granulomatous uveitis. Examples are tuberculosis, sarcoidosis, leprosy and syphilis. Okay, remember, mutton fat keratic precipitates, they are mostly seen or present in a triangle, lower triangle of the cornea, which is Earl's triangle. Okay, anterior lower triangle of the cornea, this is Earl's triangle. Another two conditions associated with anterior uveitis, these are Koppes nodule and Busacker's nodule. So another examples of anterior uveitis or condition which are seen in anterior uveitis, these are Koppes nodules or Busacker's nodules. Now how to remember? Koppes, spelling contains two P's, so it is present at, the nodules are present at pupillary margin. Okay, present at pupillary margin, P. Remember P. Koppes nodule, pupillary margin. Now Busacker's nodule are present at the surface of iris. SS. Okay, simple. Now we'll just go through this treatment of anterior uveitis. What is the drug of choice for anterior uveitis or iritis? Okay, obviously iris, the anterior part, iris and a part of ciliary muscles. So you can also say call it as iridocyclitis. Okay, so we'll just simply take it as right now as a anterior uveitis or iritis. Drug of choice for it, it is topical steroids. Okay, topical steroids, that is betamethasone, whatever you call it. Now if the examiner frames a question adding acute in it, okay, what is the drug of choice for acute anterior uveitis? The answer changes towards cycloplegic. Okay, answer changes towards cycloplegics. Okay, and that is atropine. Okay, that is atropine. So drug of choice for anterior uveitis, simply this is topical steroids, betamethasone. They say drug of choice for acute anterior uveitis, these are cycloplegics, atropine. Okay, so we are done with the anterior uveitis. Now we'll do the intermediate uveitis images. Intermediate uveitis, it is inflammation or infection of pars plana plus vitreous humerus. Okay, so it is also known as pars planitis. So intermediate uveitis also known as pars planitis. Okay, what are the finding in it? We have snowball or snowbank sign. Okay, now treatment of intermediate uveitis, okay, they are not superficial, so we cannot use topical stuff, right? We have to penetrate inside the cornea and we will use steroid injection in the eye. specifically triamcinolone. Okay, so treatment of intermediate uveitis, injection of steroid, triamcinolone. Okay, done. The next image, your favorite, headlight in fog appearance. Okay, headlight in fog appearance, it is seen in posterior uveitis, also known as choroiditis or chorioretinitis. Okay, the most common cause of posterior uveitis, it is toxoplasmosis, and this headlight of the in fog appearance is mostly seen in this toxoplasmosis. The treatment of posterior uveitis will treat the cause. Okay, we will treat the cause because HIV also causes it, and different viral infection causes it. That's why we will treat the cause in this. So we are done with anterior uveitis, intermediate uveitis, and posterior uveitis. Now we're gonna do is pan uveitis, the whole uvea. Okay, the pan uveitis, also known as the famous synonym sympathetic ophthalmitis, and question comes framing sympathetic ophthalmitis itself. Okay, the most common cause of sympathetic ophthalmitis, that is trauma. The most common cause of it is trauma. On image, what is the peculiar finding? That is Dehlen-Fuchs nodules. Dehlen-Fuchs nodules, what are these? This is cluster of epithelioid cells in between retinal pigmentary epithelium and Bruch's membrane in choroid. Okay, so nothing but epithelioid cells between retinal pigmented epithelium and Bruch's membrane. Okay, just take a look at the image. Pan uveitis, sympathetic ophthalmitis. Question is going to be on Dehlen-Fuchs nodule. Now we'll see a condition which is unilateral to the eye. Okay, so unilateral uveitis condition, it is Fuchs heterochromic iridocyclitis. The condition is Fuchs heterochromic iridocyclitis. Okay, there will be a triad, and that is the question. The triad of Fuchs heterochromic iridocyclitis, there is heterochromia, cataract, and keratic precipitates. Heterochromia, cataract, and keratic precipitates is a unilateral uveitis. Okay, unilateral uveitis. You can see the picture of Fuchs heterochromic iridocyclitis left side. On the right side image, a sign. Okay, a sign which is Amsler sign. Okay, a sign which is Amsler sign, which is seen in Fuchs heterochromic iridocyclitis. What is it? When you try to enter the anterior chamber bleeds and fills with the blood. Okay, which is hypemia. Okay, hypemia, that is Amsler's sign. So Amsler's sign is seen in Fuchs heterochromic iridocyclitis. Simple. Now we'll see some ophthalmologic finding in sarcoidosis. Typical one is candle wax dripping sign. You can see over here in image, this looks like drops of candle wax. Okay, so even I kept two images to compare itself. Both are the candle wax images over here. And the next one is mutton fat keratic precipitates. Obviously sarcoidosis, it is a granulomatous disease, like it causes granulomatous uveitis. Okay, so I have just included over here. I have told it before also that mutton fat capes are seen in granulomatous uveitis. One of the example of it is sarcoidosis. Okay, so thank you guys for this 10-minute video. We are done with images of uveitis and uvea. Okay, I don't think so the question will go out of this one. Just revise this video in fast forward manner, and you will be able to recall this in your examination. Thank you.